44, and I'm always being told that I look tired, despite following the holy grail of sleep, water, and antihistamines. I'm wondering if fillers would solve my problem.
Thank you for your question. At the age of 44, you feel like you've done all the right things of taking antihistamines and doing all the right things I'm assuming to address the appearance of your eyes based on the photo you submitted, and you want to know if fillers will help you improve your appearance. Well, looking at your photos, there are some critical things about the eyes that I'd like to focus on. And there's a reason for why I'm looking at the eyes and why they can make you look tired. You see, there's a term called micro-expressions, and there's a lot of unconscious communication that occurs when people meet you for the first time, or even your friends and family see you. And the appearance of the eyes has such a dramatic impact on how you communicate to others. And so when people look at you and see that you have puffiness under your eyes, or you have extra hooding of skin over your eyes, then that implies and communicates lack of energy and tired. Now, this is from my own clinical experience of 20 years of performing eyelid surgery, that patients always come and say, I'm so sick and tired of being told I look tired. Or in several psychology studies where people looked at just the eyes and they made some conclusions as to the emotional state or the attractiveness and feeling of that individual. So looking at your eyes, I would say that their dominant feature is the puffiness under your eyes. So if you wanted a recommendation based on the photos alone, in the absence of a physical examination, I would say consider some kind of lower eyelid blepharoplasty. Now, this is a surgical procedure. It involves addressing the puffiness which is caused by lower eyelid fat prolapse. Now, in our practice, we perform this procedure under local anesthesia with light IV sedation, which allows for quicker recovery. And typically for someone who is relatively young, I would do a transconjunctival blepharoplasty, which means addressing the fat pockets from the inside of the eyelids, avoiding any external scars and preserving the anatomy and support of the lower eyelids. So in addition, we also would do other procedures such as fractional CO2 laser, platelet-rich plasma, to help improve the skin quality. But then that would, of course, require a little bit more detailed evaluation of the skin, and it's not something I can really comment on based on this particular photo. Now, the upper eyelids is always an interesting choice for someone who has a little bit of hooding. Sometimes people have always had full upper eyelids and they don't want to change that, and I don't push them. I'll say it's up to you to make a decision on what you'd like to do. Unfortunately, a lot of people will lose volume in the upper eyelid area. So when they were young and their skin was tight and full, it looked very good. As they got older, they lost volume and the skin looks loose and hanging. So what I'll typically do is I'll just use a little Q-tip and I'll roll the skin and I'll show them what their upper eyelid could potentially look like. And most of the time I would do a very conservative removal for someone who has had very full eyelids for most of their life. But it's a transition decision, I should say, when people always had full upper eyelids, when these facial aging changes, it's almost a little bit of embracing a slightly different look that still looks very good and looks very natural, but it's different from what they had when they were in their teens and 20s. So I think that if you were to consider something, I think that fillers are not likely to be of benefit to you, and that you should investigate some type of eye rejuvenation procedure. So find some experienced and qualified cosmetic surgeons who you can meet with and get a sense of their style and confidence and ability to do the procedure you desire. And if you feel comfortable and safe and you feel like you want to move forward, then go ahead and do so. So I wish you the best of luck. I hope that was helpful, and thank you for your question.